Yeah, I know my,
It's totally
lady that
different than what I've
practically
done the
raised
last
me, she
13
put
years.
in
Yes, yeah.
$100,000
the state allocated a lot of funding for
No one, yet.
just to,
No one is doing.
you can start out with an EMT in the $16 range or
Oh,
start out with balance for 14.
Right,
And so there's some challenges with
yeah,
getting people to cough up the
yeah,
money.
I haven't done
Right.
anything.
But, so we wrote, some criteria in, like, basically there's an essay that we'll have to score. And then above that, the Ogemaw County residents get a preference point,
I just need-
or preference points for 4 elements. So, US military veteran,
Oh, well, here's the problem.
Ogemaw
Our
County
agenda
resident,
says 5:30.
I told
poverty,
Tom Monday
like
and
under
he changed it, and
$44,000
then
household income.
the
or
emails are
single
not said
parents.
by o'clock.
Okay,
Like, those are the people.
Yeah, they did.
but I'm wondering.
I double checked too.
Because right before I sent the email, I like read it all over and I.
Well, no, that's great.
And he
At
said
this
he changed it
Got it.
Yeah,
on
I
this
just
too.
wonder if our speakers,
You've
though,
got 22 people
we're
signed up.
assuming that, and they may
So,
go on.
really?
I'm gonna have to run 2 classes
So-
at this
Are
point,
they joining via Zoom?
Yeah.
which is, you know,
Well, we
you
can
guys will have to
stretch it.
step in a little on that side.
Right.
But
Yeah, I mean, I can,
it'd be cool
Yeah.
because.
Charlie, they're joining Zoom. Amy,
Amy is right now.
I mean, that's. what-
Oh,
Instead of coming, yeah.
But unfortunately, we've got a typo. on
I just-
the agenda. This is-
Justin was talking to me when I was listening,
Yeah,
so most people probably think 5:30.
yeah. Well, it'll be about that long before the accident gets cleared up and people can get in, so.
Right, so we're basically, what about,
Well, should I
Tom.
unmute this real quick? Or
yeah,
not?
yeah, is Tom listening right now?
No.
Okay,
Nothing with this.
He's in
He did
transit.
change it to 5, that's why we can
Yeah.
be in there at 5.
but I would just, yeah, if we're not, I would just stop, pause it, whatever.
Can you hear us, Amy? Hello?
They can't tolerate bad nor not at goal. Usually can't start with
Yeah.
like that.
We're gonna wait till 5:30 and then we'll start and I'll put the video on at 5:30. Cause I think other people thought it was starting at 5:30 instead of 5.
She can't start.
Thank you.
Yep. My cousin, like, he was the officiant at my cousin's wedding. Matt
Oh.
Foley.
Okay, I thought you said he married Chris Farley. I was like, I didn't even know
Oh,
they
no,
got
no.
married.
And there was one more. I was supposed to.
Yeah, I'm not expecting.
Mhm. Okay, it makes a little noise each time somebody joins, so when she pops up, I can allow her to join. Okay, we're on.
Are we ready, guys? I don't think last time, I didn't think we did the pledge. Are we, huh?
No, this is a cut and paste job, so no, we did not.
Okay, are you guys okay with that? Roll call, we don't need to do that neither. We did a sign in, correct? Any additions or corrections to the agenda?
Not that.
I was just wondering if we can maybe talk about maybe sending some of the deputies to that training.
You wanna put that underneath eight? I guess that's public comment. Let's do it before public comment.
I'll make 7A.
Deputies to training. Any other additions? Is this like a regular formal meeting? We need a motion to pass the agenda?
I think we probably should.
Probably
shouldn't we?
should, yeah. it's-
Okay. Can I have a motion to pass the agenda with the stated changes?
I'll make a motion.
We have a motion from Commissioner Wiltie,
I'll second.
support from. Gotta give me your name.
Tara.
Tara, it'll take me a minute. Any further discussion? All in favor, say yes.
Yes.
Motion carries. Item 3, declaration of conflicts of interest. Are there any?
Nope.
Item 4, review of August 10th, 2023 meeting minutes. I believe those were all emailed to us. Someone entertain a motion to approve those.
I'll make a motion to approve the minutes.
We have a motion for Commissioner Wiltie. I guess, yeah, you're Commissioner.
I'll second it.
With Sarah,
Sharon. Say the name.
Sharon, Sharon. Okay.
Should we go around one more time to introduce
I'll
ourselves?
get it. I'll get it. This is helping.
No, I mean, I'd be fine with that.
Motion
too.
from Commissioner Wiltie with support from Sharon. Any discussion on that? All in favor, say yes.
Yes,
Opposed? Motion carries. Item 5, opioid settlement community assessment, technical assistant consultation, Rihanna Merrill.
So she was supposed to be on Zoom, and she's not.
Okay, so
That's
just,
like the main event of the meeting, so I'm hoping she's.
so we'll come
Just
back to
running
that.
Late, maybe.
Item
Do
6,
you have her contact info? Maybe text
I
her?
have a phone number for her. I have a straight email.
oh, there's Amy. We seen Amy last time.
Yeah.
Maybe Amy's got while you're checking, Tim, item 6, MAC update. Hi, Amy.
Hey everyone, thanks for having me again. So a few kind of updates that I wanted to provide. In one of Mac's legislative updates in the upcoming weeks, there are going to be a few new data sources that I think will assist with your needs assessment process. So I can include those in the chat if that's easy for you all to pull them from, or send an email to everyone that was on the calendar invite, whatever you all prefer. But just a few new things that will look at sociodemographic factors, overdose mortality rates, recovery ecosystems, just some data that as you all go through the needs assessment may be helpful in better understanding. You may also have all of this data. It is publicly available already, but they are provided in a way that I think can be useful. And then there's also a separate report that Duke put together that allows us to see kind of which areas they anticipate based on publicly available data where some needs are. So I'll send those over. I also want to let you all know that on October, 25th, MAC, in partnership with Vital Strategies, the Michigan Association for Local Public Health, the Michigan Health and Hospital Association, we will be hosting a data webinar. So really the goal is to get folks like yourselves that are on these planning committees, as well as local public health folks on the meeting together to see what additional data can be pulled in terms of assisting with your planning processes. We also, in partnership with a few other agencies, have released some FAQ documents around the settlements. So those, I think, were sent out in a legislative update. I have not seen them, or maybe they're coming out this week. But I will make sure to include those for you as well. That should be helpful. They're kind of the first, well, they are the first FAQ documents in Michigan released in early September. But here to answer any questions that you all have throughout today's meeting.
Any questions for Amy? That we can think of?
The needs assessment that we're waiting for from MSU, is somebody else talking to us about that tonight, or
It's supposed to be this
is
Rihanna.
that Rihanna that's talking about that, Tim?
She was, I just sent her an email to ask if she'll be.
I just wasn't sure what she was, okay.
Anything else for Amy? Item 7, administrative updates. Tim?
A couple things for you. First, we did receive another payment in our opioid settlement monies. Our fund has just over $439,500 in it. So that continues to grow, and we'll expect to see those deposits made periodically moving forward. Based on our conversation or the last meeting, I did reach out to the Michigan Forensic Institute. That's the organization that acts as our medical examiner. They will be thrilled to participate. Dr. Mahabir couldn't join us tonight. He had another conflict, but he is on our list now. So as we progress, he'll probably be joining us on Zoom. They have several counties that they serve, and he's already serving on a few of these committees. Was actually kind of excited to join us too. So that'll, I think, be useful for us and provide us some additional insights. Amy just mentioned the webinar that we talked about. I sent you this in the email. There's a link right on it. So if you want to join on the 25th, you can just log in and do that. I certainly will. They also do through MAC monthly, every third or fourth Friday. Seminar, just, and that was similar to what Amy presented to us last time. So if you are interested, please log on the 25th. That's it. Okay.
So the last settlement that we got today, you reported at our commissioner meeting, was how much from whom?
The total of the one that just came in was $48,996.96, and that was, I believe, part of the Janssen, the original ones anyway. Pretty sure that's the one. So again, the others will periodically drop in. There's no schedule. And some of these they're going to do a 3-year lump sum, 5-year lump sum, and so it'd be fluid for a while.
Okay. And today you also, if you wanted to explain, one of the commissioners asked a question. I think it was Commissioner Scott asked how this is being distributed, just because the community is asking. Can you explain that?
So that's what this committee is going to work on as far as how these funds are going to be used. Now, ultimately, the board will make the final decision, but this group was formed to consider things like what we learn in our community assessment so that we can focus those dollars where they're going to do the most good. So that's where some of that background information will be useful to us. I know Madonna had just mentioned about training, and that's something we can fund like right now, and there is a need for it. It is spelled out, particularly for first responders and law enforcement, to offer any kind of training we can use these funds. You know, it's not going to be a big dollar item, but I think it would go a long way, at least in terms of those in the field. And dealing with some of what they're seeing. So those are things that I think we can early on do. But as far as the long-term impact, that's what we need to start with this community assessment and then start focusing those dollars where we believe they'll do the most good.
I think the question today is how we are getting the funds, not how we're going to spend them, but Commissioner Scott had asked, like, who's distributing them to us?
Right. So we are third in line. They start with the pharmaceutical companies that were signing on to the settlement. They send all of their money to the state, and then the state disperses it to the counties. And then a couple of those handouts we had, there's this huge formula that they use. And it looks like, you know, we're like 0.04% or something of the grand total across the nation. And that's gonna generate a large sum, so it sounds like a very small percentage, but it's pretty significant for our county. So it actually comes through the state and goes right directly into the fund that we've set up. And the state has told us how to set up that fund. There's a number to it and everything else and how to account for it. But that's it. The state doesn't take any of the allocation that goes to us. They do get some allocation at the state level, but what was assigned to us through the settlement comes directly to us. The state provides the oversight, so if there is any question about what we're doing, the Attorney General's office is the lead, and they will do whatever auditing they need to do. But that's it. That's the tracking, if you will, from when the funds are released from the pharmaceutical company to the state and to us.
Amy, did you have something? I see your hand is up.
Yeah, so there's two different mechanisms by which the county can receive funds. So the state actually doesn't touch the dollars you're getting now. So they go directly to Brown Greer, the national administrator. So while the state was involved in that process, they're actually not touching the dollars you're receiving now. But when it comes to the other settlements like Mallinckrodt, potentially Purdue and Endo, those funds go directly to the state and then will not necessarily go to the county at all. So you cannot count on Mallinckrodt, Purdue, or Endo dollars at this point. But they are able to, they have to give 70% of the Mallinckrodt funds to regions. They could do that through direct contracts, non-competitive bid. They could do competitive bid RFPs for those. They probably will exclude counties from being able to apply for those funds, but we won't know until the opioids task force meets. And their first meeting in over a year is actually next Wednesday. That is open to the public. If anyone's interested, it is in Lansing. There's no virtual option. Next Wednesday from 11 to noon at DHHS's building. But I think with those funds, we'll see. With Purdue and Endo, we don't know yet, so we'll wait to hear on those. But yes, the AG's office is responsible for all oversight of all the settlements except Meyer, which you all did not sign on to.
So Amy, the funds we're getting are from that's a Janssen distributor, and I think there's another one. And those
Yeah,
are the
so
funds
you
that are-
should, in your account right now, should only be Janssen, J&J, and distributors. And then your next payments are expected to be CVS, Teva, Allergan, and Walmart. And then right now, the Walgreens sign-on had an extension until the 20th. So your funds that you'll see after that second wave will be Walgreens. That'll be your third wave. And then that's kind of where it stops at this point.
And those are the funds that go directly to the counties.
Correct, yes.
Okay. All right, thanks, Amy. Item C, settlement spending. Oh, wait, collaboration for opiates, so I'm sorry, settlement spending. Item C would be the deputies to training. LaDonna, did you want to expand on this?
On the training, yeah, so I had a talk with the sheriff, and there is something called drug interdiction training. And I was just Googling right now to see, because the sheriff's not here, he was gonna address it. To see what kind of trainings are out there and available and the cost. But just kind of like my lay person, because I'm not a police officer, way of explaining it is, it's specialized training for law enforcement officers to help detect drugs in the community. So we know that we have 75 that goes right through Ogemaw County, and we know it's a known drug corridor. So that's where the drugs are coming up through. And when they conduct traffic stops, there's a way for them to ask questions that would give them a reasonable suspicion to go beyond the stop so that they could get the drugs off the streets, find the drugs, get them off the streets. But that takes a specialized training, which currently none of our deputies have. So I talked to Brian, and Brian said that he would be willing to send some of his deputies to this training. The undersheriff was looking into different schools. I know MSP has one, the Michigan State Police. and the cost of it. And once they're trained, he was willing to put on what we would call like a drug car. So that would be a car that would be specially assigned to do traffic stops. For, you know, whatever the civil infraction would be. And then go beyond the stop to see if we can't maybe get some of these drugs off the street. So it's a more of a proactive way of policing. And it's like really the first line in keeping drugs, you know, out of the hands of the dealers and abusers. So, did you have a chance to talk to Brian at all about it? Because I know we talked a little bit.
Question for Amy, does that touch that third rail of punitive, do you think, or is this more like?
Yeah. So interdiction would be on the punitive side. The training that is, not to say it's not allowable, right? Your corporate counsel is the only one that can make that determination of if they feel it aligns with the definition of opioid remediation in Exhibit E. But what's specifically outlined in Exhibit E in terms of training for law enforcement would be training around how to best respond to an overdose. And so it's really about helping that person as opposed to seeking ways to, I guess, put more folks in jail because they have substances. So it would be around training them on how best to respond or providing crisis services to first responders for the secondary trauma experience from responding to overdoses. So those are the two that are explicitly stated in Exhibit E. So the interdiction aspect would not be recommended, but that does not mean that it's not allowable.
Thanks, Amy. I appreciate that.
This is gonna be tough.
Yeah.
Because with a lot of this will come possible punitive. I mean, you could look at that at both ways. That's also helping prevention, in the long term.
Well, big time prevention.
I mean.
I don't know. I think there's a punitive aspect to everything, to be honest with you,
Correct.
because even when people go into rehab, they have, and they see a doctor, you know, they're signing a letter basically saying that they're not going to use, or if they're given them medications in their treatment, that they're not going to doctor shop and get medications from more than one doctor. That's, you know, a standard agreement that everyone signs. And if they break that, then there's punitive action, right? Because they lose their doctor. So not only does their doctor not see them anymore, but they're kicked out of a program and, you know, possibly are not allowed to, other doctors won't take them if they've been kicked out of other programs. So I think there's a punitive, you could say there's a punitive aspect to almost everything.
There are a couple law enforcement trainings that I would really recommend in this space if there are things that you all wanted to discuss with those folks. One would be CIT, so crisis intervention training, really goes across the board in addressing both substance use and mental health. Really great tool, very effective, evidence-based. The other would be training on the sequential intercept model, which are really all of the different points in time that first responders and other folks in the community can have an opportunity to intersect with someone that may need help. So it could be, they call them kind of intercept points. So as someone is, you know, being arrested, this could be, you know, this specific intercept, and here are some strategies in that space. Then there's, you know, if that person is currently hospitalized, here's some other options. So there's a lot of evidence-based practices in this space. I can pull together a list for you all if those are discussions you want to have, but I do understand the desire to get drugs off the street. Absolutely. I just, again, I think that, you know, attorney's going to have to make that call.
I think we should pose the question to the attorney.
And if you could get me a specific place to go to where it describes what this is, and that's what we'll shoot down and
Okay.
talk.
Okay, I know, I call him Frenchie. Under Sheriff Burchett was looking into it, so I'll find out what schools he researched and have him forward those on to you.
Anything else? Did you hear back at all?
Heard nothing else.
I mean, is there any way she could forward us this information? I hate to.
When was the last
continue-
time you had contact with her, Tim?
Was this week, yeah, it's Monday or
Wow.
Tuesday.
Weird that you wouldn't, at least something came up, we wouldn't hear something.
Does anybody else have any, since our previous meeting, any discussion, any ideas, anything?
I do. Amy, I'd like to know more about, I have asked a few people and me working in the field, I do know that transportation is a big problem for us getting others back and forth to residential. What do you see in that area?
Yeah, so the state released an RFP, not a very accessible RFP. It's closed. I think it was only open for a week. I'm trying to work with them to say this is not a sufficient turnaround time for counties to be able to apply for these funds, but counties were not eligible for this one for transportation. So in places like Indiana, I'm seeing the state partner with like Lyft or other kind of ride share companies or local taxi companies to offer free services to folks going to treatment. In Michigan, I've seen a few pilots take place, not necessarily with settlement funds yet, but a few pilots take place where folks are extending bus routes or offering even gas cards or gift cards. And then I have seen some counties with settlement funds even purchase vehicles to assist with transport needs. The problems with transport usually involve really those legal aspects and who folks can drive. So if there is an agency that's already providing transport, being able to expand those services is much easier than the time that it takes to develop all of those policies and procedures associated with what that looks like. So can someone be driven if they are currently under the influence? Can someone be driven if they potentially have some sort of mental health crisis? What liability insurance is there? So there's a lot of different aspects to consider, but transportation is absolutely allowable with these funds.
Thank you.
So can I ask you, what is the main problem? Is it the money for gas or is it the actual vehicle?
No, the actual vehicles, well, usually we do gas cards, whatever.
Okay.
But it's so hard when we have all these organizations, Catholic Human Services, 1016. I have 3 last week that I had to take one on Monday. We didn't have anybody to take the second one on Monday. We don't have drivers in the community.
So I'm gonna ask you to give me a call.
Okay.
Sometime at the beginning of next week, maybe.
Okay.
For 2 reasons. One, if it's a gas card thing, there is something called the community support team, which I'm probably sure you're familiar
Yeah.
with. And that is something that they will fund. So and that's a medical need. So if they're getting into like inpatient or even to go to outpatient, they would consider that a medical need and they would be able to fund them with, giving them gas cards so that they could fill up their own tanks and get to treatment. But if it's a vehicle that they need, currently, the Michigan State Police does have a program in place. It's called the Angel Program. Are you familiar with that?
I am familiar with the Hope Not Handcuffs Angels program.
Okay.
But with the Michigan State Police, the only problem with that with transportation is that they check for warrants. And we're here for recovery. And a lot of people that we don't have the vehicles, a lot of people don't have licenses.
So they don't check for warrants.
The
That's the whole,
Michigan State Police.
that's the whole point of the program. You will
When
not get around
they-
that.
When,
Spoke with troopers that have told us that they do.
yeah, they do.
I don't think they do. I'll find
I
out.
have to
They-
Call me. I'll
they-
find out.
They
Because
do.
that's the
I
whole
think
point
they
of the
do.
program. The whole point of the
Right.
program is if you come, if you report to the MSP, if you have drugs on you, if you're currently using whatever, there will be no
Repercussions
So,
for that charge.
for
but
that
they
charge,
will-
right?
Right, but they will search for warrants and they will arrest.
so I work.
So if there's pending
I-
warrants.
Mhm.
what's her name?
Lozana.
Lizetta, I worked the comeback quick response team
Okay.
in which, I met with police officers and I got people to and from inpatient, intensive outpatient. I connected them with resources. The comeback quick response team through Families Against Narcotics, we don't check for warrants.
Mhm.
Okay, the Michigan State Police Post does check
Check for warrants.
for warrants.
All right, I'll look into that, because I was under the impression that they didn't check for warrants. The whole point of the program was to get them there.
Right, we have a couple of troopers that sit in on a lot of our prevention meetings and stuff around, it's several counties. And they've all said that, yes, they do check for warrants. Because I specifically asked that, because that was one of the reasons I wasn't referring patients to go there.
Mhm.
Because I'm not sending them there to get arrested,
Yeah.
I'm sending them there to get help.
Yeah.
And so I confronted them and said, do they do that? He said, yes, they do. And I said, well, that's too bad.
And it
because
does, but maybe
that's
if you could
missing
get
a
some
lot of
change through there, we'd
Yeah,
love
let's
that.
Look at
but-
that, because, you know, it
Um,
depends what the warrant's for. I mean, if it's a simple bench warrant for failure to appear, who cares, you know, but
Right,
if
they
it's.
will take a misdemeanor warrant, but if there's something out there that they will take them to, and they don't know. Until the person goes in there and they run it, the person's not gonna know. If
Yeah.
it's gonna be considered a minor offense or if it's gonna be considered something a little bit more.
Mhm.
And so there's no definite,
Yeah, because most of your bench warrants and your misdemeanors, I'm sure even if they called the
So,
court would
but
recall them and if
it-
they were going in a
It
treatment.
does seem like that with us sitting here. However, it doesn't work like that.
Yeah.
So maybe you can do some, so, yeah,
We have,
but transportation is
A
a
problem.
great, yeah.
That's too
That's
bad because
everywhere.
they already have. like,
Information
their
for them to know.
volunteer-
oh, I'm not saying.
So we have,
Volunteers in place that are willing to transport.
we do
Yes, we
have
do.
217 recovery up in Traverse City.
Mhm.
Corey is a very dear friend of mine. And unfortunately, you know, we have people at the spur of the moment that finally, you know, surrender. We have to let him know a week in advance. He only has 2 drivers. They're driving across the state to come get our clients to drive, you know,
Yes.
downstate or wherever.
Mhm.
So it's a
It's a
huge
challenge.
problem right now.
Yeah.
I think our guest speaker is on. Rihanna?
Hello, yes, sorry about that. I was having some issues with my Zoom. But yes, thank you for inviting me here today.
You have the floor.
Thank you. So I was just going to share a little bit about what MSU is able to do, what we have the capacity to assist with, and what the community assessment process is like. To start off, our process is extremely community engaged. We like to make sure that the work that we're doing is assisting and that the ownership of the project and the ownership of the community assessment is within the community, because as it is, you guys are going to understand what your community needs and where to really be looking for answers is. So our process starts off with checking in with prominent figures within the community, those that are already doing work in addressing substance use disorder and opioid use disorder. Those might be like the health department, the sheriff's office, things like that. Once we've kind of established those connections and gotten an idea of what the lay of the land is, so to say, we like to invite those individuals to join almost like a working group where we can openly discuss what we want to gain out of a community assessment, what kind of questions we're looking to answer. Those questions are pretty broad, things like what are the gaps that are in the county, or what services are being utilized the most. And then moving from there, our team kind of steps in to really help put together surveys, put together focus group questions, and organize more of the logistics of the community assessment for you. We would be willing to host focus groups online or to travel to the county to sit down with some individuals and host a focus group in person, asking questions, getting to know the community needs. And then after that, we would, our team would also help with creating kind of a final report or any other end goals that you're looking to come up with. Some counties are doing requests for proposals and using the data from the community assessment for that. Some are hosting town halls and presenting the information learned from the community assessment to the county as it stands. But that's just kind of a quick walkthrough of the process. I do have, I just want to see if I'm able to share it. Just kind of an outline of what the steps in the process look like. Let me see here. But it's mostly just what I've been over. So starting from getting to know the county as our team, and then planning it out with those individuals that we've identified as like stakeholders or just prominent figures in the community. But that's kind of just the overall idea of what we're here to help with. Are there any kind of like specific questions that you guys had for us, or any ideas of what the community assessment you guys would want to do within the county?
Have you guys been doing many of these community needs assessments?
I think we're at about 14 or 15 right now, across the state. They're all at different stages in the process, but so far, none of them have wrapped up the process yet.
What turnaround time are you anticipating?
It's dependent on how large of a community assessment everyone wants to do. For the very in-depth ones where we are doing larger surveys that run for more time, doing, you know, upwards of 10 focus groups, we're looking at about, I would say 6 to 8 months for those. But with the smaller, if we wanted to do a smaller one, more direct, I would say that it would be, hesitantly to say this without knowing for sure, but I would say 3 to 4 months for a smaller community assessment.
Questions for Rihanna, Commissioner Wiltse?
Not right now.
Questions for her? Go ahead.
Yeah, if, the group that we've got here established in this committee is a pretty good cross-section of people who are directly involved on the front lines. If we start with our group and then determine if we need to expand to, you know, larger, maybe there's, you know, some component that's missing, but maybe just build it from there, at least get us going anyway with this group, and have that be a meaningful, you know, study, and something we can use.
Yeah, I think that building off of what's already established within the community is a great place to start. If you have a group that is already within different sectors addressing the opioid issues, the substance use disorder issues, then I think that starting there and just once the process gets started, it's flexible. So if you realize partly through that we've been working on this, but we're really missing kind of like an education perspective, then you can always rope them in and ask for their input later on in the process too.
I really think we've got that first step done in terms of establishing stakeholders. And we've got a pretty good cross-section.
Absolutely.
We have law enforcement, we have counselors, you know, people in the health and so on. So I think we've got a really good start, and I just would hate to see us lose time trying to gather more when I think we've got a good place to begin.
Yeah, if you guys are confident in the starting group, and if we were to join in right now, I think that our first step then would be developing the guiding questions for the assessment and just getting started on that.
Was there a cost to this?
No, this is completely free. Yeah, sorry. No, this process is completely funded by the opioid settlement MDHHS put together, the 3 universities, to provide this at no cost to the county.
And you guys coming in, are you gonna know a little bit about our community as far as size, population?
Yeah, we would do a little bit of background research. And then we would also ask that if you have any reports that you think are relevant, any reports, any previous assessments that have ever been done by any organizations within the county or by the county itself, we would review that too. So we have a knowledge coming in.
Okay. Questions? So the first step would be a questionnaire to us. Am I not interpreting this correctly?
Yeah, the first step, it would be, there are a few questions, yes, for that, but they wouldn't necessarily have to happen in a meeting. They could happen on your own time, and we could review it separately. And then in a first meeting, it would be more of developing the questions that would guide the community assessment. So questions like, what is the biggest gap in the county, or what services can be implemented to address needs within the county. We have kind of like a worksheet to go through with that, and it's about a 30 to hour long meeting that we would work with you to do that. And those guiding questions are what shape the rest of the community assessment and let it, when we write a survey, we're going to be using those questions to guide us with the survey questions.
Okay,
Okay.
I think we're definitely to that point.
And then the community surveys will gather the information based on what we're lacking in the community.
Yeah, if that's the direction we want to go, that is a pretty standard question that we want to ask, is what gaps are people encountering? But we also might want to ask in a community survey if they're accessing different services in the county, or if they have to leave the county for it, or just getting an idea of what is being used could also be a question.
I just am frightened with the word survey. Unfortunately, a lot of people do not respond to those surveys. I just wonder if the information that is needed with all of the individuals on the board here, if we're able to compile the needs assessment. I mean, we have school board members, we've got frontline workers, we've got teachers, we've got healthcare providers, of a large variety here. I mean, I'm wondering if with the information that we obtain, if that would be enough for a community needs assessment.
Yeah, I think that information, we wouldn't ignore it. We would definitely include it. My only hesitant with that is that I would want to make sure that people with lived experience within the community are also getting their voice heard. But if there's a way to do that without surveying, I think that's also possible. So maybe asking for a focus group of individuals within the community, sometimes those can get a little more participation. And I also know that we are able to help with providing compensation for those events, for surveys or focus groups. And that I believe, and Amy could correct me here, but I believe it's also an expense that's allowed within Exhibit E.
One of the questions I have is, you guys have different groups at different stages so far. What has been your experience with getting some of those community surveys back and feedback? Obviously, we know we cast a large net and catch a few fish. But what is that quantitative response that you guys are getting?
We have had pretty good response rates in more urban and in more populated areas. They've been higher survey responses. Adding a compensation aspect has also increased survey response rate. When people know they're going to get a $15 gift card, they're just more likely to finish the survey for us.
Yeah.
But we've also had really good success at, yeah, we've had good success at doing focus groups at like a recovery home and just taking some of their time to chat about what their experience is. We found that they're pretty happy to share. They like having an opportunity to talk.
Because I think like we all have experiences, and to be honest, I don't know in what roles most of us are in. But I certainly also appreciate the fact that we likely aren't or haven't experienced what the drug addicted person might experience. So to see what they view as those gaps in the community versus what we see as gaps in the community could be very different.
Yeah, and that's one of the pushes with doing it as a very community engaged assessment, is making sure we're getting both sides of the story, because sometimes where that disconnect happens is something that can be remedied even.
I'm just curious, so when you're doing the survey, are you trying to hit certain demographics or something that sort of, is around what Ogemaw County actually has? Because sometimes surveys, like you get a survey on, a large percentage of the people are women, because women tend to fill out surveys at a higher rate than men, or, I mean, it's just true. And so, or, we don't want all middle-aged people or all, what I'm saying? So do you like gather demographics and then try to like maybe get a focus group, or, go to a certain spot to survey, just so that it's really kind of, I don't know, it shows
It
what
reflects
the population is of Ogemaw County.
Yeah, if that's something that we encounter throughout the process, there's definitely steps to remedy disconnect in the getting a higher population than that we really have. And there's also the option of, I know in one county, we're trying to reach, pregnant people and just choosing to go to OBGYN to do a focus group to fix that and make sure that we're actually really dialing down on that, is kind of an option for the process. It all kind of depends on where we want to go with the community assessment. It's a little flexible, but that's what we're here to help with, is to make sure that we are collecting the information needed for it.
How are the surveys distributed, and what steps do you guys take to make those accessible to the broad population?
We have, we use MSU's Qualtrics system.
Okay.
It can be distributed online. There's QR codes that we've used. I'm sure there's a few more options it's a pretty robust system. I haven't experienced all of it so far.
Familiar with it.
But then it allows for translations if we need to do any translations. And we also are able to copy it over into something that can be printed out and taken on paper too.
Okay.
So the next step at this point,
Yeah, so the next step at this point, if you guys are interested in kind of moving forward with the assessment, is I would, well, first I would connect with my team, but then we would also have a follow-up meeting with you guys whenever would work best for you. And we would compile those guiding questions for the assessment and doing that worksheet.
I mean, can you get that worksheet? I think we're in agreement, we're moving forward with this, correct?
Right.
Can you get that worksheet to us now so that we can complete and get back to you before the next meeting?
Yeah, I can send it via email. I have a kind of questionnaire for the different sectors, and I can send that over to you guys.
And then are you able to meet with us again a month from now? Is that adequate time for you to gather the information we're going to get to you?
Yes, that would be perfect.
Are you guys okay with this?
Yep. Amy? Real quick, I'm wondering about, I know that 1016 up here, they're expanding their intensive outpatient. And they just opened one in Standish. What about something to look at like that for the disbursement? How does that work with recovery?
Yeah, there's a lot of opportunity in that space. So if I'm not, they're considered a recovery community organization, correct?
Correct.
So they should be receiving additional funds from MDHHS.
Yeah.
I'm guessing for that expansion, and outside of what is already in their kind of standard appropriations through MDHHS. With RCOs, there's a lot of opportunities. So you can you can pay for training for recovery coaching or certified peers. You can fund, again, transportation, so vehicles, those types of services. Infrastructure can also be covered. So if there's a physical expansion or new things that they need for their facility. This also applies to any sort of treatment provider. And then you also have a lot of other options in terms of, new programs or different supports that they may need. But I think really in the RCO space, the options are kind of endless. And every time I'm kind of talking about the recovery space, really want to talk about kind of the ecosystem, right? So in a lot of counties, we're seeing an expansion of the recovery courts, but making sure that the folks that they're referring to also have that expanded capacity. So whether that's the recovery spaces, whether that's the treatment spaces, healthcare spaces, whatever it may be, looking at the entire ecosystem with all of these things. Does that kind of answer your question?
It does. Thank you.
Any other questions for either Amy or Rihanna? Is it Rihanna? Am I saying that correctly?
It's Rihanna. I think you got it the first time.
I'm sorry.
No, it's all right.
Any other questions for either one of these? So Tim, you will get the information and send it to us?
I'll at least provide everybody's contact information, and they may want to send it to you directly.
Okay.
But whatever, we'll make sure you get it.
Okay,
Thank you.
thank you, guys.
Thank you.
Thank you.
We do, and I apologize, we do have some new members here tonight, so if we do want to go around real quickly, I believe this gentleman, if you want to introduce yourself,
I'm Justin Rogers. I'm the director of Ogemaw County EMS.
you're the new director.
The new director.
New director.
Congratulations.
Thank you.
Nice to meet you.
Appreciate it.
Might as well keep going.
All right, Charles Wiltsey, Ogemaw County Commissioner.
Jenny David, Ogemaw County Commissioner.
Shannon Davidson, certified peer recovery coach for Asavo Valley CMH.
LaDonna Schultz, Ogemaw County Prosecutor.
Sonia Reiser, certified peer recovery coach, Catholic Human Services. And my mission.
Sonia,
And my mission.
I have met you.
Yes.
I don't believe you were here last time. Last
No, I wasn't. She invited me.
Okay,
I
perfect.
Thank you.
Perfect. Thank you.
Thank you, thank you. Thank you.
Sarah Rose, probation parole. Kelly Darby, administrative assistant. Okay.
Can we get yours again? I was
I'm
thanking
sorry.
her and I
Shannon
didn't.
St. Germain, I'm the RN coordinator for MAT for my mission.
You talk really fast.
What?
I might get nervous.
As fast as you.
So the LT gave me a text back and they do run warrants on Angel,
Mhm.
which was news to me because it's kind of defeats the whole purpose of. the
Yes,
program.
that's how I felt.
Yeah, that's what's made it really super hard. And if we could just get a program like 217 recovery that,
Mhm.
yeah, it's needed everywhere.
I think
Because the majority of people who are out, they probably do have some warrants or some, they've in the past had trouble.
are worried they have warrants.
Right.
Yeah.
I mean,
Yeah.
And the sad thing about it is we can't use Medicaid
Yeah.
because of risk. And, a lot of times they are still under the influence. They're detoxing. So,
Mhm.
yeah.
I know Michigan Works, I talked to them, we talked about some other individuals on the board, so again, I thank you for coming, both of you that are new this month. Michigan Works, Mark Burdam does plan on attending, but could not tonight, so did you hear from the school, Whitmore Prescott or Ogemaw Heights?
I
Okay.
thought Trisha was going to be at this meeting, so.
And whom else were we, you said you talked to some other individuals?
I
Heather
talked to
LaForest,
Heather,
the health
Heather
department.
LaForest. I'm waiting for her to get back with me. I called Michigan Works and talked to you about that. I'm gonna go down there. And then Heather Hum of 1016. So
Yeah, I'd like to,
working on
I'd
it.
like to see if she could come to our next meeting and we could find out more about that.
Yeah, for sure. It's greatly needed.
DHHS, who, I thought we talked about them too, the health department, did somebody happen to reach out to them?
The health
I did.
department,
It's
or-
Heather.
yeah, that was
Heather
Heather
LaForest.
LaForest.
Oh, I'm sorry.
Yes, and she did agree and to come to the meeting, but she had obligations this time, so.
Okay, and then MSP, didn't we talk to them as well, or were we thinking about it and weren't?
They were on the list of, potential.
Okay, I just know that was from previous meeting that we.
Noble, MSP. Officer Noble.
Noble.
Yes.
Yeah.
Yeah, he would be a good one to come because he's involved
He
in
does
the
a
coalition
lot.
stuff around
Yeah.
here and all this. He's Houghton Lake, he's Ogemaw and Roscommon.
Yeah, I think he's.
He does a lot.
Community relations.
Absolutely.
Yeah.
Yes,
Okay,
I'm waiting for a meeting with him.
any other ideas before we? Oh,
Kathy's got her hand raised.
I'm sorry. Hi Kathy. Go ahead.
Hi, this is my first meeting, so I just thought I would introduce myself.
Sorry.
Wow, that's okay. I'm Kathy Dollard and I'm the service line director for behavioral health at My Michigan. So I work with Sharon and Sonia. I also just wanted to say that My Michigan is working with our FQHC in Houghton Lake, Mid-Michigan Community Health Services, to bring an MOUD or MAT clinic to West Branch. So it'll be on Progress Street. So it will.
Kathy, can you, all these abbreviations,
Yeah,
Right.
yeah, of course.
I get so many
So
every day now.
medication for addictions treatment or there's, so that's sort of the old way to say it, or MOUD is medication for opioid use disorder. So it's basically medical treatment for people who have an opioid use disorder and prescribing buprenorphine mostly to help people to stabilize and to get back on track, but also, with the use of therapy and peer support, counseling, on help. So they are going to be opening in the next few months. We just
Oh
have
my goodness.
signed
this is
lease
just
agreements,
Yay.
for our
It's
space of
gonna be
progress.
like 3 days a week, Dr. McMorrow will be here.
That's great.
You're currently open
gotta
in
get your
Fulton Lake or Prudenville, right? You have a clinic up there?
There's a clinic, Dr. McMorrow has a clinic in Houghton Lake at Mid-Michigan Community Health Services, the FQHC there. So with some deregulation that happened recently, they're able to have a satellite in West Branch. So they will be opening pretty soon. And Sonia, I don't know if you've been talked to about this, but I'm assuming you might have heard that because Sonia is our peer recovery coach at our health park, but having like if you could work kind of a little bit in both areas, that sort of have a good liaison between our primary care and that OUD clinic, I think would be really.
I'll work everywhere.
Okay, awesome. I think we have some shared patients between those two. The other thing I was gonna just mention, and for Rihanna as well, is that, health systems and hospitals always have to, every couple of years, have to do a community health needs assessment. So I think we could make sure that you got that community health needs assessment, because I think in every hospital that we have, substance use disorder comes up as one of the biggest needs.
Yeah, that would be great.
The other thing I was gonna just mention is that My Michigan is at the end of this month will be opening a medical managed withdrawal treatment available at our hospital in Clare. So it's another word for that is detox, medical detox, for patients that have a level of need that is exceeding what they could get in a detox setting. That's more like a social detox, say like they might get at Sunrise or some other place like that. So it's usually people who have a comorbid or with medical conditions. So they need to have detox, but maybe they have a medical condition. So it warrants actually having that happen in a hospital setting rather than, some other, like a rehab setting. And so, and then because there are some people who maybe have been using alcohol for a really long period of time. And so it could be more complicated, especially say they have high blood pressure or diabetes or something else with that. So we're partnering with a team called Special Care Hospital Management, and they help with training and setting up programs across the United States. So we feel pretty confident. You use medical surgical beds, just having some of those set aside, because in a community like Clare, we often are not full of patients, and so we have some capacity. So our hospitalists and our nurses will have extra training and order sets and whatnot to help people through that. And then a coordinator who will be able to assess that patient, that they're right for that level of care, but then also make sure that they have a plan when they discharge for outpatient care and for the rest of their recovery. We're not interested in helping somebody just to, detox and then not have that path forward for their recovery. So I just wanted to make sure that folks here knew about those two new treatment things. That I guess treatment moves forward from My Michigan that we've been working on for a long period of time. And now that there's been some deregulation around licensing, we've been able to do that.
Thank you.
Thank you.
Thank
The
you.
update.
Very excited about them coming to West Branch from Houghton Lake. I've heard nothing but good things about the Houghton Lake program, so it's good news.
Oh,
Excellent.
yeah, I have quite a few people that
I'm
come up there.
excited.
I just have one thing. After our last meeting, Sheriff, myself and Mike Bowers were just talking at the airport there. And, we're kind of discussing like some of the old school things that we used to, programs like DARE and, I remember growing up for me, that would have been in the nineties. That was a huge thing. I mean, we wore t-shirts and we went to them and they really made a big impact. Like I said, I remember them clearly. It just seems like there isn't any of those programs anymore.
Because they're federal funded, and in order to get the federal funding, they have to meet like a certain criteria, and DARE didn't pass that criteria, so it's no longer funded.
But I mean, we could look into the option of doing our own county level program.
That would be awesome.
Well, I
That
think
would
it's a
be really
needs test,
cool.
right? Or they have to meet certain goals, and it just wasn't meeting the goals. So
That's a great idea.
they said it was, politicians like it because,
I wonder how they got the
had the
data
whistle
though.
send the back, but
Data to
as
meet.
far as stopping drug use, it wasn't effective. I think the only goal it met from all the do your own research, but this is just why I think DARE went away. Was the only goal that it didn't meet was having a DARE officer in the school. The kids tended to look more favorably on law enforcement. Because they had that interaction with the officer, but other than that, it failed on all other, so it was not eligible for any more federal funding.
I think
Amy?
these days, the youth and teen programs, I mean, even through the IOSCO Drug Free Coalition, I think they had 42 kids go kayaking down the river. They did a fishing derby. I think that if we could get the coalition in Ogemaw County lifted back up and
I think
get these kids out here.
I think that'll come
Worth
from
the
the needs.
conversation.
I think that'll come from the needs assessment. I mean, I don't disagree with that, but I think that needs
No.
assessment is going to give us that information. Amy, did you have something?
Yeah, so when we're looking at the Johns Hopkins principles, which have been widely accepted across the country and endorsed by over 60 national organizations, one of those is investing in youth prevention. Now, the key with youth prevention is ensuring that the activities that are being funded are evidence-based. DARE ended up not being evidence-based. It may be evidence-based again now with some updates to what they're doing. But in the way that it was not actually preventing use or initiation of use, even though, we can see that things are happening, have to make sure that these things are actually impacting the youth. So when we hear, so-and-so is going to tell their story and have this big event at the school, it sounds good, but what we know is it actually doesn't create the lasting impact. So I just put in the chat, it's a toolkit from the rural health folks, and they link to a lot of resources that outline which are the evidence-based strategies for youth prevention. Really important place to invest with settlement funds, but also just really making sure that everything is based on the data. And I, pulled this from the rural health folks to make sure that, we're not looking at what works in Detroit or Grand Rapids. We're really looking at what may work elsewhere. And so please feel free to dig through those links. Otherwise, I'm happy to pull different resources. And I would love to continue that conversation in future meetings as well.
How do we get that information off the chat? Can someone?
I'll email it. I see that she keeps sending links, so I'll
Oh.
email it.
Just email
Okay.
us.
Oh yeah, I'm sorry for whoever's at the computer.
Oh, it's okay.
Thank you. Any
That was
public,
the word evidence-based. Thank you, Amy.
I was missing something like that.
Yeah.
any public comment?
Thank you.
Schedule our next meeting.
Yes. We're thinking like 12
Angel brochure. It's very misleading because it's.
12th
of
Is that-
October.
that give them enough time till today's the 14th, so today is the second Thursday, so the 12th would be.
Or the 19th.
Really don't.
That'll be our board.
So
The 19th.
Right. Oh, yeah, at 4, yeah.
Uh,
Well, we couldn't do that, 'cause we got commissioner meetings.
Yeah, we do.
Yeah.
So it'd have to be the 12th, the 19th and 26th, we have commissioner meetings.
How's-
12th.
Yeah,
Okay. What day
it's
is
a
that?
Thursday, so it's the second Thursday.
5 o'clock again.
Yeah.
Try that again.
Is that here?
5 o'clock.
Here,
Well, it was kind of an.
It's more roomy.
Oh, yeah.
yeah, we have more room.
It was 5 o'clock, but it got typoed. It's 5:30.
Are you guys okay with that?
You were the only one. It was
Is that okay, you guys?
What is it, 5?
5 o'clock?
Oh, there's my card. Do you have a card on you?
I don't. But I'll bring him.
Get this.
Well,
You
you
guys are all okay with that?
Card.
Or if you have a card, I can write my information. back.
I don't think I do
Only
because I
have
don't
one.
have my,
Here.
Instead of 5 or 5:30, because that was very confusing, because
Yeah, Sonia, you're gonna come next.
It was
month,
just,
right?
it was unfortunate, hold on, guys.
Everybody, let's see.
It was just transcribed wrong on the actual agenda, so that's why we had to do 5:30, but at the last meeting, we had originally decided 5, so 5 o'clock to work for people. So it would be 5 o'clock, October 12th.
12.
I'm right here at the annex building. Okay. Any other, you guys okay with that?
October 12th.
I can
5
give my
o'clock.
cell number too.
Okay, can I have a motion to adjourn?
Here, let me put my phone there.
I'll make the motion.
I'll support. We'll be adjourned at 6:30. All in favor, say yes.
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 We are adjourned. Thank
Thank
you.
you, everyone. Thank you, everyone. Have a good night.
that's my game.
Okay.
See you.
You're not telling me.
Next
Thursday.
Okay.
Glad to hear things are going.
There you go. And thank you, LaDonna.
Yes. I mean, we knew, typically the transition in the beginning.
Home to bed.
Seems like it's.
Yeah.
Oh,
So
So that's a really good thing.
I told you, you could have it back. It's fun every day.
Be careful, honey.
Told me,
Be like,
Yeah.
he said, for Shane Noble, he does a background check to include a warrant check. If it's a local warrant, he will call the court to make arrangements for to have that person turn themselves in late. If it's a felony, then we have to make the arrest. Shane
That's
says
right.
that this is done to protect the volunteer drivers who take the person for treatment.